So very good afternoon everyone. I am Dr.satyabrata, MDDM clinical pharmacologist, and today I am going to discuss on the role of omega-3 polyunsaturated fatty acid, that is PUFA, in CVS, cardiovascular disorder. Coming to introduction, omega-3 fatty acids, also called N3 fatty acids, are polyunsaturated fatty acids. In omega-3 fatty acids, the first double bond in between the third and fourth carbon atoms from the tail end. So this is the structure of important omega-3 fatty acids: alpha-linolenic acid, eicosapentaenoic acid, and docosahexaenoic acid. That is alpha-linolenic acid ALA, eicosapentaenoic acid EPA, and docosahexaenoic acid DHA. Next, coming to sources of different fatty acids. Omega fats, the non-essential fatty acids, omega-9 oleic acid, that is available from safflower oil, sunflower oil, etc. And omega-6 fatty acid, linoleic acid, that is the essential fatty acids. Omega-6, that is linoleic acid, that is found in cotton oil, corn oil, soybean oil, sesame oil, etc. And gamma linolenic acid, GLA, that is present in black currant oil, and primrose oil, etc. Then omega-3 fatty acids, that is DHA, docosahexaenoic acid, present in fish and sea algae. EPA, eicosapentaenoic acid, present in fish and sea algae. ALA, that is alpha-linolenic acid, present in flax seeds, chia seeds, etc. And mostly saturated fat, dairy fats, cocoa butter, nutmeg butter, coconut oil. Saturated fat are present in dairy fats, cocoa butter, nutmeg butter, and coconut oil. So these are the sources of different fatty acids. Then the three types of omega-3 fatty acids involved in human physiology are alpha-linolenic acid, eicosapentaenoic acid, and docosahexaenoic acid. Alpha-linolenic acid found in plant oils, EPA and DHA both found in marine oils, eggs, meat, fish, etc. Marine algae and phytoplanktons are primary source of omega-3 fatty acids. Mammals are unable to synthesize omega-3 fatty acids but can obtain it from diet. Then coming to cardiovascular disease. The cardiovascular disease divided in physiological risk factors like hypertension, high blood cholesterol, hypertriglyceridemia, diabetes. Behavioral risk factors like diet quality, physical activity, adiposity, smoking status. So that can lead to ventricular arrhythmia, congestive heart failure, heart valve problems, stenosis, mitral valve prolapse, then atherosclerosis like coronary heart disease, angina, myocardial infarction, cardiac arrhythmia, sudden cardiac death, and cerebrovascular disease, stroke, like ischemic stroke, hemorrhagic stroke. So cardiovascular disease is an umbrella term that encompasses all diseases of the heart and blood vessels. There is a general consensus that adequate intakes of fish oil, or omega-3 PUFA, polyunsaturated fatty acid supplements have favorable effects on cardiovascular outcomes. However, the primary cardioprotective effect of long-chain omega-3 PUFA, polyunsaturated fatty acids, seems to be on the last step of CHD, congenital heart disease, arrhythmia. For this reason, sudden cardiac death, SCD, appears to be the most consistently affected clinical outcome. Then this is the omega-3 fatty acids. In lipids, it will decrease the triglyceride and RLP, lipoproteins. Then in vessels, decrease the inflammation, and endothelial function increases, and vasodilation. In platelets, they help in reducing the platelet aggregation and increase the blood rheology. So acting on lipids and vessels, it can cause plaque stabilization, and the plaque stabilization and the platelet function will lead to cardiovascular protection, and so that there will be reducing arrhythmias and increased mitochondrial function. So in this way, omega-3 fatty acid protects the cardiovascular system. Then coming to mechanism of omega-3 fatty acid in cardiovascular disease. The cardiometabolic effects of omega-3 fatty acids continue to be extensively investigated and remain an active area of research. Omega-3 fatty acids can ultimately increase arrhythmic thresholds, reduce blood pressure, improve arterial and endothelial function, reduce platelet aggregation, etc. Then the anti-inflammatory effects of omega-3 fatty acids. Omega-3 fatty acids reduce the content of arachidonic acid AA in membrane phospholipids in platelets, endothelial cells and inflammatory cells, which reduce production of arachidonic acid derived pro-inflammatory mediators including prostaglandins, thromboxanes, leukotrienes, hydroxyeicosa, tetraenoic acid, 5-HETE, EPA. Eicosapentaenoic acid also acts as a substrate for cyclooxygenase and lipoxygenase enzymes, which could increase a different family of eicosanoids, the 3 series prostaglandins and thromboxanes. Then omega-3 fatty acids could downregulate the activity of the nuclear factor NF-κB by activation of PPAR or inhibition of toll-like receptor. Rho kinase is a downstream effector of the small GTPase Rho and mediates diverse cellular functions such as smooth muscle cell contraction, cell migration and proliferation. Then long-term treatment with EPA, eicosapentaenoic acid, significantly inhibits Rho kinase activation in the myocardium. Supplementation with EPA, eicosapentaenoic acid and docosahexaenoic acid (DHA) could exert a protective effect on the heart through improvement in mitochondrial function and the efficiency of ATP generation. Then inhibition of platelet aggregation. Omega-3 fatty acids decrease the risk of thrombosis by inhibiting platelet aggregation. Supplementing a diet with omega-3 fatty acids downregulate mRNA expression of platelet-derived growth factor A and B in mononuclear blood cells in humans. Then triglyceride lowering effects. Omega-3 fatty acids play an important role to regulate genes that are critical for controlling lipid homeostasis. Omega-3 fatty acids decrease VLDL assembly and secretion, resulting in diminished triacylglycerol production, promote beta oxidation simultaneously in mitochondria and peroxisomes, possibly through the activation of peroxisome PPAR alpha leading to low triglyceride level. The remnant lipoprotein RLP produced from the triacylglycerol rich chylomicrons and VLDL exerts potent pro-atherogenic effects and is thus regarded as an important risk factor of CVD, cardiovascular disorder. The involvement of RLP, that is remnant lipoprotein, suggested in the pathogenesis of sudden cardiac death and restenosis after coronary angioplasty. Omega-3 fatty acids do not have a major effect on fasting total cholesterol and LDL cholesterol, low density lipoprotein cholesterol levels, but EPA, eicosapentaenoic acid, effectively reduces RLP, remnant lipoprotein, in hyperlipidemic patients. Then improvement of endothelial function. Long-term treatment with fish oils augments endothelium dependent relaxation of normal porcine coronary arteries, for which eicosapentaenoic acid, a major omega-3 fatty acids of fish oils, is responsible for the augmentation. Long-term treatment with fish oils improves endothelium dependent relaxation of hypercholesterolemic and atherosclerotic porcine coronary arteries and femoral veins. Eicosapentaenoic acid augments endothelium dependent relaxation by NO nitric oxide as well as that by endothelium derived hyperpolarizing factor. Then docosahexaenoic acid alters caveolae microenvironment by modifying membrane lipid composition and by changing distribution of major structural proteins, eventually increasing nitric oxide synthase, endothelial nitric oxide synthase activity in human umbilical vein endothelial cells. Nitric oxide also inhibits platelet aggregation and adhesion, leukocytes adhesion, and smooth muscle cell proliferation. Then plaque stabilization. Through their anti-inflammatory effects, omega-3 fatty acids could not only prevent the plaque development but also contribute to the plaque stabilization. The randomized clinical trial demonstrated that omega-3 fatty acid supplementation substantially increases tissue levels of EPA, eicosapentaenoic and DHA, docosahexaenoic acid, and decreases macrophage infiltration and thickened fibrous cap in human carotid arteries. Exacerbated release of matrix metalloproteinase MMP by the activated endothelium and macrophages plays a pathological role in plaque progression and instabilization. Then anti-arrhythmic effects. The omega-3 fatty acids incorporated into cell membranes and affect the ion channel function of myocytes. There are several mechanisms by which omega-3 fatty acids could exert anti-arrhythmic effects. Inhibit voltage-gated sodium channels, prolonging relative refractory period, and increase voltage that are required for membrane depolarization. Also exhibit a modulatory action on L-type calcium channels, resulting in lower cytosolic free calcium and calcium influx rate and in preventing cytosolic calcium overload during ischemic insult. Then long-term treatment with EPA, eicosapentaenoic acid, reduces ischemia-induced ventricular fibrillation in pigs in vivo, for which attenuation of shortening of monophagic action potential duration through suppression of cardiac KATP channels may be involved. Antiarrhythmic effect of omega-3 fatty acids due to their effects on autonomic control, especially by increased vagal tone. Through these mechanisms, omega-3 fatty acids may prevent ventricular tachyarrhythmias and hence decrease sudden cardiac death. Then various studies conducted outside India about the effectiveness of omega-3 fatty acids in cardiovascular disorder. Some studies show effectiveness in cardiovascular disease and some don't. The conclusion of some studies showed that only in high-risk populations a fish consumption of 40 to 60 grams per day is associated with a markedly lower CAD, coronary artery disease mortality. Then AHA, American Heart Association recommendations for omega-3 fatty acid intake. Population. Patients without documented coronary heart disease should eat a variety of preferably oily fish at least twice a week. Include oils and foods rich in alpha-linolenic acid, flaxseed, canola, soybean oil, flax seeds, walnuts. And patients with documented CHD, congenital heart disease, consume 1 gram of EPA plus DHA per day, eicosapentaenoic plus docosahexaenoic acid per day, preferably from oily fish. EPA plus DHA supplements could be considered in consultation with the physician. Patients needing to lower triglyceride, 2 to 4 grams of EPA plus DHA per day provided as capsules under a physician's care. Then prescription omega-3 fatty acids, EPA and DHA ethyl esters. Omega-3 acid ethyl esters is a combination of ethyl esters of omega-3 fatty acids containing 465 mg EPA and 375 mg DHA in a 1 gram capsule. Omega-3 acid ethyl esters is FDA approved for very high triglyceride levels more than 500 mg per dl. The daily dose of omega-3 acid ethyl esters is 4 grams per day, taken as a single 4 gram dose, 4 capsules, or as 2 gram doses, 2 capsules given twice daily. So EPA and DHA free fatty acids. Omega-3 carboxylic acids are a fish oil derived mixture of free fatty acids with at least 850 mg of polyunsaturated fatty acids, including multiple omega-3 fatty acids, EPA and DHA being the most abundant. Omega-3 carboxylic acids are FDA approved for very high triglycerides more than 500 mg per dl. The daily dose of omega-3 carboxylic acids is 2 grams, 2 capsules, or 4 grams, 4 capsules once daily. Then EPA ethyl esters only. Eicosapent ethyl is a 96% pure ethyl ester of eicosapentaenoic acid. Eicosapent ethyl is FDA approved for very high triglyceride more than 500 mg per dl. The daily dose is 4 grams per day, taken as 2 capsules twice daily. Coming to summary, omega-3 fatty acids exerts pleiotropic cardiometabolic effects with a diverse range of action, most of which are beneficial for the cardiovascular system. Supplementation up to 1 gram of omega-3 fatty acids per day is well tolerated except dyschezia and does not increase the risk of bleeding. Recently published Trials did not show effect of omega-3 fatty acids on cardiovascular system. However, as suggested by current guidelines, the potential values of omega-3 fatty acid supplementation in CAD and MI and possibly in those with heart failure remains to be encouraged. So these are my references. Thank you very much. Jai Jagannath.